So, a very warm welcome to one and all. Good morning, good afternoon, good evening. And as we all are in the sixth day of the 7-day awareness program of yoga therapy, and we have come across till now, we have revealed the 5 secrets of yoga therapy. And today is the sixth one, and it is very important, one of the most important aspects. And every secret was really very important as we saw in the last few days. And today is also one of the secrets of the yoga therapy. And today we'll be discussing more on the yoga therapy core, that we can say that what actually yoga therapy is. And yoga therapy, as we all have seen, that there are some misconceptions regarding the yoga, and there are misconceptions regarding that yoga therapy and yoga both are similar also. So that myth will be also cleared, and the secrets will be revealed by our eminent speaker of the day, Dr. Balaji sir. So all will be joining. Just I will give a brief what we have done in the past a few days, past 5 days. In the past 5 days, when we started with the Dr. Ananda sir, and he explained what yoga tradition is and what are the misappropriation that we all are dealing with. And apart from that, that what are our responsibilities that we saw, and gradually we were enlightened with the knowledge of Dr. Meena ma'am, who showed us the clear picture of what salutogenesis is and what are the differences between yoga therapist, yoga instructor, and how they can do their work in a more efficient way. And later on, we saw the pranayama session, and the secret of pranayama and what are the differences between breathing and pranayama. So that was cleared with Sangeeta ma'am. And then we moved on to the Kalavati ma'am. She explained the alignment of the asanas and awareness, what is the importance. And on the last day, on the fifth day, from the Wales, uh, it was revealed that how the relaxation is a very important part of our uh, yoga practices. And Gyanadeva sir, he explained it very well. And Yogacharya Deepika ma'am also revealed the secrets in a very eminent way, very profound way. And we were enlightened with all the knowledge that our mentors had. So with those words, I will just start with the invocation with Gayatri Mantra followed by Guru Gayatri Mantra. So all can join. So join with me. Gayatri Mantra. Om Bhur Bhuvah Swaha Tatsaviturvarenyam Bhargo Devasya Dhimahi Dhiyo Yo Nah Prachodayat. Guru Gayatri. Om Tat Paramparaye Vidmahe Jnanalingeshwaraya Dhimahi Tanno Guru Prachodayate. Om Om Yoga Maharshi Dr. Swami Geetananda Giri Guru Maharaj Ki Jai. So I welcome you all on this platform of Live Holistic Wellness, who has organized this wonderful 7-week awareness program on secrets of yoga therapy with the eminent speakers, eminent mentors of Geeta Nanda yoga tradition. And today we have with us our respected Dr. Balaji sir, who will be revealing the secret of yoga therapy and the preventive, supportive, and curative approach. So without taking much of the time, I will just give a brief about Dr. Balaji sir. So Dr. Balaji sir is an assistant professor at Center for Yoga Sciences at Vinayaka Mission Research Foundation of Arupadai, Bedu Medical College and Hospital. He is a medical consultant at Mother Care Foundation, Center for Alcohol De-Addiction and Rehabilitation at Puducherry for past 6 years. And apart from this, he has also completed his MPhil and PGDYT PGDYT in yoga therapy through Center for Yoga Therapy Education and Research CITER of Sri Balaji Vidyapeeth, and he was awarded as the gold medal for securing university first. And he has also completed his master's in science in yoga therapy through Tamil Nadu Physical Education and Sports University. He also completed his post-graduation degree in Ayurveda and Herbal Sciences. And he has received many awards such as Yoga Chamal, Yoga Bharati Dynamic Yoga Award, Best Yoga Asana Demonstration Award, Michael Dankworth's Gold Medal, and Best Karma Yogi Award also. He has won many prizes in the Yogasana competitions as well. And he has been working tirelessly for the enhancement of alcohol and cannabis addicted patients for the past 5 years, combining yoga and allopathic streams, offering a holistic treatment for the patients and their families. He is working his best to bridge yoga and the modern medical allopathic streams in all the possible ways. And in this pandemic time, he is one of the frontliner who was dealing with the COVID patients and helping the COVID patients. And he's the COVID warriors, we can say in a way, and he's doing his job perfectly. And today he is also very busy in all his activities, and in his busy schedule he has provided his valuable time to us. So I welcome on behalf of Live Holistic Wellness. Thank you so much for joining us, and thank you for taking the invitation. And sir, today without taking much of the time, I will just hand over to you, respected Dr. Balaji sir.
Namaste to all. Good evening. Vanakkam. Thank you, Nilachal Bayan, for your kind introduction. And yes, without wasting time, we'll start the session today. I'll just share my screen. Will you be able to see my screen?
It is not quite visible, sir. You're sharing the screen, but it is not visible.
No? Is it
Yes,
visible
sir, it
now?
is visible now. Now visible, sir.
Again, namaste. Good evening to all the people who joined in this webinar, Yogina session organized by Love Holistic. And it's a privilege to talk in the great people of Geetananda Yoga tradition who have just finished their session in the past week. It's an honor for me, though I was a kid who joined in Yoganjali Natyalayam under the guru guidance of Dr. Anand Balu Yogi Bhavanani sir, who brought up me for the past 25 years. It's a tough job. So I just want here to share a few things about yoga therapy, which is preventive, supportive, and curative approach. As a lot of things was discussed, the shared teach by Dr. Anand Bali Yogi Bhavanani sir, and in our tradition, a few concepts I took from Dr. Ramesh Vigilani sir, and few hands-on experience taught by our director, Dr. Madan Mohan sir. So I just collected everything together, and I'm just going to share a few things which you may know already or which may be new to you. So it's a kind of discussion. So whenever you have doubt, please note it. At the end of the session, we can discuss in detail. So prevention is better than cure was a saying in English. That was Maharishi Patanjali also said the same thing. Heyam dukkam anarkatam. Prevent those miseries yet to happen. If we address a thing or if we start the thing in the early stage, definitely we can have a quality of life in a high standard, not only for us, through our family, and through our family, we can promote our society also. So that is the first step, prevention, preventing everything. And when you have entered into the so-called this E stage, and whether we can support the yoga therapy by allopathy, Ayurveda, or some other thing, that thing yoga plays a vital role in supporting also. Then the next one is a curative approach, curation. I won't say like I don't want to mention the name, like few people say they can cure AIDS by these kind of practices. No, that is not true at all. There is a stage where you can cure a disease, but that depends on when you are coming to the a consultant, a doctor, a yoga therapist, or a Ayurveda therapist, or a herbal therapist, or a pranic healer. But there are few stages that we can't do anything. But in yoga, only in yoga, we can improve the quality of life. We can make that particular individual die in happily, death by peace. That is possible only in yoga therapy, which may not be possible that much to other forms of therapy, especially the allotherapy. So to go one by one, this is my favorite slide, the slide of our guru, the founder of Getananda Yoga Tradition, Ananda Ashram, ICYR, Yoganjali Natyalayam, the father of scientific research, our Swamiji Geetananda Giri Guru Maharaj said, whenever we feel there is a difference between you and me, when we see the difference, when we see the difference, and there starts a question whether you are big than me or whether I am big than you. This sort of comparison starts. And that comparison, if we are in the negative part, that leads to fear. And if we are in the higher part, that leads to ego. Both are not good, actually. So this sense of duality leading to fear, that creates imbalance in the mind first, then slowly it settles in the body. That leads to disease. So duality is the leading cause to create a fear, and thereby by creating imbalance and leading to disease in the body. The principle, the basic principle of yoga is union. Everyone is one, and the concept of Vasudeva Kudumbaka. We all are one. So that is the basic principle of yoga. And by this, we can prevent many things by feeling that you and me are one. All the living creatures are one. By simple of this thought will prevent many things. And the modern culture, as now we are living for the past 10 to 15 years, especially the past 5 to 10 years, there is an autonomic dysfunction is happening. There is a time set by God when He created us. At a particular time, we have to eat, a particular time, we have to sleep, the particular time will take us to process to digest food, and particular time, we have to get the signal from the body and we have to excrete. But that is not happening. Autonomic is dysfunction we create by ourselves. Whenever we want to sleep, but at the time we can't able to sleep because we'll have some other work. So we'll take coffee or some cold beverages, a carbonated drinks, and we postpone our sleep. Sleep is a natural thing. A simple example that creates a lot of autonomic dysfunction. And because of this autonomic dysfunction, we are having a normal bacterial flora in our gut and in our mouth. So whole the digestive systems, it starts from the right hand and it ends in the left hand. The whole of the digestive system, we have some normal flora. So if this bacteria is not doing the normal physiological thing, again, they will turn into a pathological microorganism. That way it causes many diseases. And the overnutrition. So there is a lot of discussion is going on about what is good diet. This diet is good, that diet is good, a Mediterranean diet, a protein-rich diet, only dairy diets. No, it's diet is limited to a particular individual. It depends on the person, it depends on his age, it depends on his race, it depends where he is living, it depends on his occupation. This is not the easy thing to give a dietary advice to a number of people, the same kind of dietary advice to a number of people. So this misconception is happening a lot. Because of this, a lot of other conditions like non-communicable diseases together go into the metabolic inflammation. Whenever the inflammation starts, we have to rest and we have to turn our body to peaceful. But that is not happening. Whenever some inflammation happens, we are keep on pushing ourselves and make the information to spread all over the body, and that ends in a modern kind of diseases. So COVID is no wonder it's one of the modern kind of diseases. So what is yoga? There is lot of definitions given by Maharishi Patanjali, but it's there in Bhagavad Gita. So generally, how to say what is yoga? It is not only as a techniques for improving the function of the instruments. Instruments is our body, our mind. It also has the guidance on how to use the instruments. It gives a gross idea about the instruments and how to use the instruments. That also it gives us a brief guidance. So simply to put in a way, yoga is equal to technical guidance technical guidance plus guidance based on spiritual philosophy. If you look into the WHO definition of health, health is a state of physical, mental, social, spiritual well-being, not merely any absence of disease or infirmity. Now, where the spiritual aspect came, and where the spiritual aspect is there in other therapies, especially the modern medical system. So, there's a to connect with us and to the universe and connect with the Jivatma and Paramatma, yoga plays a vital role. That's why it is not only a technical guidance, it is a guidance based on the spiritual philosophy. This is yoga. Then what is yoga therapy? According to the International Association of Yoga Therapists, yoga therapy may be defined as the application of yogic principles to a particular person. Just underline word or a particular person with the objective of achieving a particular spiritual, psychological, and physiological goal. They have mentioned the spiritual part first, psychological part first, and physiological goal as a third one. It starts from the higher and it goes into the lower part. That the way it works from the Karna, Linga, Sharira, then Sukshma and the Stula. It just comes in that order actually. The main aim is yoga is a Anubhava Shastra. You have to experience yoga by performing yourself. Then only you can be able to apply it as a therapy to you also and to other person also. You should have the basic deep understanding. There is not a prescribed thing like that Ardha Machendrasana, the twisting asana is good for diabetes people. No, 10 diabetes people, you can't just write a prescription and it is not like that. Yoga therapy is not like that. If any diabetes patient comes, okay, schedule. Ardha Machendrasana, Chandranadi Pranayama. No, that is not yoga therapy at all. My guru used to call it as a yogopathy, symptomatic approach. Yoga therapy is a one which addresses the particular person, the principles of yoga therapy to the particular individual person and achieve to connect, to detect the root cause and connect him with the spiritual universal energy and treat him both psychologically and physiologically. This is a simple and best definition of yoga therapy. Now, one has to be very careful of what not to give because I told already yoga is not a prescription. Yoga therapy is not a prescription. So we should be more careful about what to do not we should give to others. So there are many disadvantages are there. So we have to broaden our vision to identify it. What is the advantage of modern medicine is disadvantage of yoga, and what is the advantage of yoga is disadvantage of modern medicine. So that is a simple way to do it. That's why we have to integrate and balance and to give it as a holistic therapy to improve the overall health or to improve the quality of life of the individual or a patient. I won't like to call a person a patient as a patient because he also has a name. So in my practice, I adapted that I won't call him as a patient. I used to call him wherever I treat the patient in my clinic or in the hospital or in a yoga therapy or Yoganjali Natyalayam or the online consultation, better to call him this name because the name is given for that particular soul that is also calling by him, it's you will remind him that so and so person, that is also a kind of healing. So I don't want to address everyone as a patient. So limitation of yoga therapy is not a miracle cure for all problems, especially the problems caused by the road sudden emergencies, road traffic accident, poisoning into it. But it is not cure for all the problems. If you take the root cause of that problem, that can be dealt by yoga. And use discriminant, viveka, vairagya, not for emergencies. Definitely, I can't able to ask a person who is suffering from heart attack to sit and do deep breathing. So that is not ethical at all. And definitely, please consult a doctor where in doubt. Don't give preference to your your ego. Just give preference to your so-called individual person, because you have to clear something that you don't have. That's why there are many types of specialized doctors are there to clear the minute particles, because if you approach micrologically, we can see the difference wholesome. That is why we have to consult a doctor whenever we have a doubt. And as I already told you, each patient is different, each individual is different. We can't give the same type of treatment or say same schedule can't be given to a 10 to 15 members who are having the same kind of diseases. We have to study them one by one, then only we have to give the treatment. And different approaches of different tradition. This is a common disadvantage of yoga, but now the things are happening that everything is coming in a one way. And don't be a quack by studying the book or listening to a video or the audio. You have to practice first. Where how you have to practice? You have to get a teacher, and then you have to understand what he says, and you have to practice by yourself, then try to apply it on yourself, then only you can give it to others. That's why it means don't get work. Now, what are the advantages of yoga therapy? Our topic is preventive, supportive, curative, whether yoga is promotive and rehabilitative also. It is a science of philosophy and art. In what way we can give that, according to us, we can take it as, because in hospitals or in a research aspect, we are taking yoga as a scientific part. Whenever we are teaching the spirituality, it becomes a philosophy. Whenever we are doing the difficult asanas or doing the traditional pranayamas, it becomes a art. And yoga is one of the most peculiar things in yoga or the yoga therapy is it involves the body, mind, and spirit. How it involves? It involves through the breath. Breath is the key aspect in yoga. And the desirable positive side benefits. A person is coming from low backache, and because he is having a constant backache, he can't able to concentrate on anything, and he can't able to sleep also, because if he turns to right or left, definitely there's some amount of pain is there. Whenever one is feeling the pain within him, he can't able to do the things with full awareness. So when he comes for yoga therapy practices, automatically the pain will be subsided, and definitely he will have a good sleep, and the next day morning it will be a fresh new start for him. So that the desirable positive side effects is possible only in yoga. Whereas if in allopathy system, if we are giving a painkiller, like a non-steroidal, non-inflammatory drugs like NSAIDs, like Oviron, or some other Myospaz, Ivermectin, what we will give to prevent the gastritis caused by this non-steroidal anti-inflammatory drugs, we will give one more drug called proton pump inhibitors called pantoprazole, omeprazole, or Rantac. Why? Because this non-steroidal anti-inflammatory drugs, NSAIDs, will cause gastritis, and to prevent the gastritis, we have to give one more drug. And this drug also have some of the side effects. So So that is happening in allopathy. But in yoga, we are going for one problem, automatically some other problem which is hidden inside, it just goes off. That is, we call it as desirable positive side benefits and simultaneous improvement in health and control of other condition. How it is simultaneously improving? Because yoga as giving the awareness, yoga and yoga therapy just give the awareness to your body, mind, how to sit, how to eat, how to sleep and when to sleep. All these conditions will create a big awareness to us. And that's how it helps to improve in health and control the other condition. Relief from the stress, the main cause of Aditya Vyadi, psychosomatic disorders. As I told in the front, that yoga is not used for emergencies, so-called road traffic accidents and poisoning or any kind of most of the things, because these are the things commonly we face in the emergency wards. What is the cause for this road traffic accidents or poisoning intake or suicidal things? There is some hidden stress inside. Some hidden stress is there within the person inside. No one is there to address the stress. If we take the stress, if we sit with that person and if we just counsel them for 10 to 15 minutes, definitely we can remove the hidden stress and definitely we can improve the quality of life for that individual. So those are also called out. Those things of road traffic accidents, suicidal attempts, also belongs to this psychosomatic disorders. Now, how yoga differs from physical exercise? It is holistic. How it is holistic? Because yoga is the one which connects the individual with the universal energy, the individual energy with the universal energy, the Jivatma to Paramatma. So it just makes the connection. Other things is just physical movement. It doesn't have any connection with any other things. And it is a very slow, gentle and steady stretch. And part by part, it works on all the parts of the body. And it develops the, as I told, yoga is the Anubhava Shastra. Because we are experiencing and doing it, it develops the inner awareness. It is non-straining, not high impact. Definitely it is non-straining because we are using our hands, we are using our neck, we are using our legs, we are using our abdomen, we are using our waist, we are using our everything what we have already within us. So definitely we are not depending on other things. So it's definitely non-straining and non-pharmacological. It emphasizes on respiration, not perspiration. Stretch, slow movement, and breathing with full awareness. These are some of the few simple things that differentiates the yoga or the yoga therapy from the other physical exercise. Now, what are the potentials of yoga therapy? It is prophylactic, preventive, supportive, and curative. So we'll go into this is the most important prevention. As I told in the first part of my speech, prevention is most important. That's why Patanjali also emphasizes Eham Dukkam Anagatam. Prevent those miseries yet to happen. The Clark are the authors of this tertiary levels of prevention. They have proposed this for allopathy way of treatment. But yoga has, when it origin, it adapted or it can be dealt in all kind of these prevention. And in advanced to these 3 levels of prevention, there is one more prevention called quaternary prevention. Thanks to Dr. Ramesh Vigilani sir for giving us this wisdom when he spoke in CITES IDY celebration. So I'll go step by step now. Primary prevention, which includes health promotion and specific protection. Secondary prevention, which is early diagnosis and prompt treatment. Disability limitation. Tertiary prevention is rehabilitation. So health promotion. Well, how yoga or yoga therapy promotes this health by the important tools of Achar, Vihar, Ahar, promoting the physical activity, healthy diet, and good sleep. If your spine is healthy, if your sleep is good, and if you're able to do there is no any shallow breathing, definitely it will be healthy. That is the most important. How yoga works on it? By using various asana, pranayama, kriya, mudra. So very simple, following the techniques in yoga or the yoga therapy, definitely it promotes the physical activity. And the concept about diet, whenever a patient, I have uh, people have lots and lots of confusion in the dietary habits. My simple principle about diet is eat the things which is freshly prepared. Eat the thing which is prepared, which is more close to the nature. Always have adequate hydration whenever you eat. And the next meal, when you're going to take, you should feel that hunger. Without hunger, you should not take the meal. If you're feeling hunger only, you should take that meal. And that hunger should not be prolonged for a long time. If you feel hunger, in the next 10 to 15 minutes, you have to have the food because the Jatara Agni is already stimulated. If you waste the Jatara Agni, it will end up in Ama. Ama is a disease or toxic. What toxic will get if you postpone it, and it will you will develop gastritis. If it keep on increasing, what will happen? Helicobacter pylori will jovially grow in your gut, and this Helicobacter pylori is make your gastritis very severe, and it is happening for the long time. And you did endoscopy, you took all the antimicrobial treatments also. Still, the Helicobacter pylori is very strong. It will end up in gastric carcinoma. So starting postponing your diet when you are feeling hunger, you are not eating at the time, it will end to cancer. So the simple diet is eat food which is freshly prepared, eat seasonal, eat which when the food is prepared more towards the nature, adequate hydration, and the most important thing, the next diet, the next meal you should feel hunger. You should have the hunger. Okay, that's a sign to eat actually. And good sleep, nowadays it is not happening. So people, when I ask how much time you are sleeping, people used to say 8 hours. Then what's your problem? Why are you having? What time you go to bed? Take till 3 o'clock at the night. Oh, 3 o'clock in the night. Then when you'll get up from the bed, 10 o'clock or 11 o'clock. Okay, that's all. The whole endocrine organs, especially the master of endocrine pituitary, secretes a particular hormone, the melatonin, during the early phases of the night and the late phase of the early morning. That is totally gone for him. Then, if the endocrine gland is not working properly, automatically the fuel is not ignited, all the parts of the body will have that friction. That friction will lead to develop of toxic, the armor. When the armor develops, automatically you will feel the symptoms, and the symptoms develop the signs, and with the signs, you will end up in a particular kind of disease, and you will be labeled as end organ damage, or you will be labeled with so and so disease person. So sleep is one of the key factors. Yoga helps the person. That's why I already told, when a person is suffering from some kind of a problem, automatically that problem is corrected, and it will make some of the positive side effects, like improving its quality of sleep. Quantity of the sleep is not important. How quality you are sleeping. But that REM, rapid eye movement, non-rapid eye movement, these things are happening or not? Are you having a good dreams, or you are having a ghost dreams? That depends on the individual. What is he is having in back of the mind? Because during the dream, the things which are very subtle and which we like most, that we usually experience most kind of things like that only. That is the quality of sleep. The ghost dreams, the accident kind of dreams, someone is going that we are running, that is not a good type of dream at all. Then that is health promotion. Then the primary prevention, the second one is specific protection. Specific protection, how? Our body automatically has some specific acquired immunity. By it proliferates the microorganism at its stores in the memory cell. Remember, we will have a chicken pox in our small age. If we have a chicken pox, the next time it's not coming to us. How? Because we have acquired the immunity for chicken pox. Our cells will know that this virus will enter the body. This virus is already there in the body and it is stored in the memory cell of the B cell, and it again prevent that virus to cause the infection. It may enter, but it doesn't cause any infection. That is the key aspect. That is what now people are telling. If they are, it's once you are exposed to corona, the second time you won't expose. But corona is not behaving in that way. But mostly what we are seeing also, if once the patient have a COVID infection, the next time it will be a very milder form. But for some cases, it goes in the worst stage also. But if we do yoga in the early stage, definitely we can improve our immunity. We can improve our specific acquired immunity by doing the Shat Kriyas and Shat Karmas. And the proliferation of the B cells will be increased more, and the memory cells, the storage in the memory cells, that memory will be enhanced every time by performing the yoga therapy. This is a primary prevention of yoga therapy or primary prophylactic by performing yoga therapy. Early diagnosis and prompt treatment. Whatever disease may come, that you have to detect early, and we have to give the prompt treatment as early as possible to prevent the complication caused by the particular disease. So recent times, if one is having cough, cold, fever, we advise them to go and isolate yourself. Go with you, enjoy with your family members. Go and isolate in the room. Then they will say, no, I went outside in a hot sun, or I came home, I felt very tired, I took cold water. Because of the cold water, because I exposed to the hot sun, I have fever, headache, and body ache and all. So, okay, if it is like that, considering to the current situation, you isolate, you take the tablets. In 24 hours, if your symptoms subsides, then the reason is correct. But if the symptoms is not subside, then you are having COVID. Go and test the next day. This is what we tell the patient. Early diagnosis and prompt treatment. Most of the people didn't follow that. That is the reason the second wave is called a tsunami. It's not a wave at all. That's why major death happened. The diagnosis, they are not diagnosed at the early stage, and we are not started the prompt treatment for them. That is the reason it happened. Coming back to yoga therapy, sorry. If we do yoga properly, we will avoid the micro changes in our body. We will be able to see the micro differences, what is, and even a twitching. Some have the common twitching of eyes will be there. Sometimes you have numbness in the proximal part, the tip of your fingers, or some part of your body. Actually, there will be some numbness will be there. Even a simple micro change that will be able to know by properly practicing the yoga and yoga techniques. And that subtle changes, we can help to go for early diagnosis and get us a proper treatment. That is possible because yoga is make us aware, and yoga is a conscious. It makes us not only our body conscious, our mind and emotions also conscious. That is why early and prompt treatment is possible in yoga therapy. Disability limitations, because when the person is diagnosed as diabetic hypertension, it's a silent killer. There will be some microvascular complication happening inside the body if the sugars are not controlled. The sugars are not controlled by taking the food alone. It depends on the mood. It depends on what kind of mindset you are. It depends on the sleep, and it depends on everything depends on the sugar values, not only the diet alone. So when you get that diabetes or hypertension, to prevent the complications, to arrest the complications, because what is the common complications? The microvascular complications includes the eye damage, kidney damage, and nervous system damage. Or else the macrovascular complication, goes into stroke or heart attack. These are the commonest complications of diabetes and hypertension. Preventing this complication and make you free from the disability, disabled person. That is a key role of yoga. If you diagnose with some disease, yoga helps to prevent yoga helps to prevent the progression of that particular disease. Vivahar, that interpersonal social relationship will, that is also a kind of disability limitation, because what kind of person we are and to whom we have to attach. If we are going to attach with a person who is doing on more evil things, automatically we will also turn evil. So to identify the correct interperson relationship, that also yoga plays, or yoga therapy plays a key role. How to understand other people and how we have to behave with other people. So that is also a dislimitation for our mind. And rehabilitation, accept everything, prasada buddhi. Accept everything like however it happened. This is a tertiary prevention, because nothing is there in our hand actually. So whatever karma we did in the past life, or whatever karma, I have seen many things, I face some instant karmas. So I can feel if something bad happens, I will immediately think that because of that thing, I'm facing this thing. I'm happy because the karma works immediately. I actually happy that it's happening immediately for me. So that prasada buddhi, accept everything what it happens, that knowledge, that broader vision comes with yoga therapy also. That is the ability to restart, the ability to grow again, that willpower, that resilience given by yoga and yoga therapy by practicing it. And the last one, quaternary thanks to Ramesh Vigilani sir again for this word, loss of fear of death and dying in peace. I just included that not in pieces, because many people have that fear of death, especially when they have the responsibility. When we have a, if you think before marriage or before finishing the college educations, or before getting into the job, we don't have much of responsibilities. After that, one has a big responsibility of taking care of, that is an emotional responsibility and social responsibility. When first we didn't have that responsibility, after some particular age we have that responsibility. At certain age we are not going through this, we are not going to take care of disability. Then at the first stage, who took care of it? The divine took care of it. So divine knows we are going to die. Divine knows that he will again take care of that responsibility of ourselves. And detachment, vairagya, it's very, very difficult. Vairagya is very, very difficult. And that regaining the cortical control by deregulating the senses, if that will only happen by practicing the yoga and yoga therapy, applying to the yoga therapy. If one has practiced it, he will be dying in peace without peace, because body is just a is just the embodiment of a soul. It's just going to transform. We are going into the other embodiment soul. It is a travel process. Then why we have to attach this deha? Why you have more focus on this deha? That kind of awareness, that kind of jnana will be gained during the yoga practices. So a beautiful saying about that by Sri Aurobindo, the Mahan, the great yogi in Pondicherry. We are lucky, we are born in Pondicherry and we are having a great Siddhas here, including Sri Aurobindo, our Swamiji. Now a living Siddha is Amaji, and of course Dr. Ananda Sen. Death is a stride, a door, a stumbling strike. The soul must take to cross from birth to birth. See that wonderful line. A great defeat of pregnant with victory. What a wonderful saying. So a great defeat of pregnant with victory, a whip to lashes us towards our deathless state. What is a beautiful definition given by Sri Aurobindo about death. I used to say to Ananda sir, I won't feel, I never bothered about me actually. When, when I was, when before I was getting married, I most of the times I said to sir, I don't bother about me, whatever happens is okay. Now I have a feeling I used to bother about me because I have a kind of responsibility. So I often used to get into that state also, whether I should detach from this so that I can be able to work more. I can be able to do better things for more. If I attach, I can't able to do that. So that kind of vision will be attributed by yogic practices. So supportive, whatever things you have, if a person is diagnosed with coronary artery disease, his heart is blocked, 50% heart is blocked. Definitely yoga plays a key role in giving an adjuvant therapy. That is a part of yoga therapy because 50% of a stenosis or a block in the coronary artery disease, we can't give them a full of yoga therapy. We can add yoga therapy along with the modern medical system, slowly work on him, slowly do the cardiac rehabilitation and reduce the dose by reducing the stress. This further blockage will be prevented by the medical management. And the stress and the fatigue and the tiredness, no drugs will prevent the fatigue and tiredness. Only the mental state can prevent the individual from fatigue and tiredness. Yoga will do that, remove the fatigue and tiredness by focusing on the particular area of the individual awareness. That is why it is a supportive therapy at a particular level of need. And it helps to bring out the best in an individual, whether it may be a cognitive function, a decision making, concentration, memory, psychomotor performance, effective learning, and tolerate to stress. How yoga makes the person to react with the stress. So that's one simple way. Yoga always used to de-stress disease. This is one of the simple mechanism of action. Because after getting into the yoga or after giving a yoga therapy to a particular individual, they will have developed a vision inside them. And they will develop the things, normalize their perceptions, accepting the things as it is. That is that prasada buddhi. And it will develop the attitude of you are responsible for whatever happens to you. If someone calls you, if you are not sleeping properly, if you are not eating properly, if something happens to you or to a family member, what kind of role that you played so that it manifested. That acceptance is the key for healing. Just know that acceptance is the key for healing, and acceptance will reduce your stress. So first normalize your perception and optimize your reaction. And a very golden statement of my guru. It's very, very difficult to practice, but don't react. Whenever something happens, don't react. Try to digest it and try to respond it. Optimize your reaction. Release the stress, prevent the senses dominance. Release the stress by prevent the senses, the pancha karmendriya, jnanendriya, sensor dominance. That's why yoga plays to regain the control of the cortical junction of your brain. If that will be gained after your the dasa indriya dominance, the automatically stress will be released. This is a simple way to key way to deal with the stress. Normalize your perception, optimize your reaction, and release the stress by prevent the senses dominance. Curative potential. So how? That's why if the 50% of outplay can be tackled with both yoga and modern therapy, if it is a 90%, definitely yoga alone or yoga as an adjunct therapy alone cannot be cured. He has to undergo a coronary artery bypass surgery, a heart bypass surgery. Then we have to do a slow intervention, yoga therapy intervention for him. Definitely after the first bypass surgery, then once he get out from that cardiac care, slowly yoga can add. But initial, that treatment is most important. So curation depends on at which time the individual goes to the therapist. So we can't, yoga alone cannot cure many things. It needs some of the other system to act also. And it depends on the stage where the individual goes. That is the most important thing. And curative is most effective in yoga through the lifestyle intervention, ahar, vichar, vihar, achar, vivahar, everything. These are the key lifestyle modifications in yoga, and reduction in responsiveness, as we seen before itself, and adjunct therapy, psychosomatic disorders. Through these kind of actions, yoga can be cured in many ways. So remember, a great psychiatrist, Dr. Rama Reddy sir, told that only 1/3 of the patient antidepressant pills work. And most of the patient, they don't know what to do. They are giving the same drug to all kind of patient. Anxiety also they give, depression also they give, for some mood disorders also they give. They don't know because it acts for everything, and it may antipsychotic drugs induces sleep. Why it induces sleep? It will make the person calm. But it does not addresses the root issue. That is the problem. That's where yoga helps to identify the root issue, and it cures the psychosomatic disorders better than the antipsychotic drugs. So these are some kind of examples. Now, what are some simple and useful yogic principles to adapt as a yoga? Psychological reconditioning and development of appropriate attitudes such as yama, niyama, chatur bhavana, pratipaksha bhavana. Stress management through counseling, jati, sukshma vyayama or stula vyayama, asanas, kriyas. The kriya is not a simple movement. According to Ammaji, kriya is a systematic, rational movement. Each and every movement has some meaning to both body and mind. And pranayama, breath energy, organizing techniques. Normalizing the metabolic activity through Surya Namaskar, asanas, kriyas, mudras, bandhas, pranayamas, etc. Surya Namaskar is one of the beautiful techniques for our endocrine system. The most important system which is benefited in Surya Namaskar is our the endocrine gland is our Surya Namaskar practice. Relaxation, visualization, and contemplative practices to induce a sense of inner calmness and well-being. So this is more possible with dharana and dhyana. Now, everyone after the COVID, they told breathing exercise is most important. Even the people who are people who are against yoga, people who don't want to do yoga, and they started to do deep breathing exercise. Why? Because deep breathing is economical. This is formulated by or proposed by our director, Dr. Madan Mohan sir, a great physiologist and a man who has integrated yoga and modern medical system, and who is the reason for modern medical universities is having a yoga department. He proposes normal breathing, shallow breathing, and deep breathing. The volume of the lungs depend upon the rate of your respiration, and the ventilation remains the same, and the dead space remains the same, whatever the respiratory rate you give. The normal respiratory rate is 16 to 18 seconds. If you breathe 6 times, that means if you inhale 6 count and exhale 6 count, the 1 per minute, the respiratory rate is 5 to 6. That's simple way. That is a deep breathing. Sarah has mentioned here. If you inhale for 6 count and exhale for 6 count for 1 minute, the respiratory rate is 6 only actually. Now we'll compare. We'll study this. I already told the rate of respiration depends on the volume of the lung. So if the rate of respiration is 12, the volume of the lung will be 5,000. This ventilation and whatever the space you inhale, that some 150 ml of air is dedicated to that dead space. So that ventilation and dead space won't change at all. But the rate of respiration and dead space volume, it has to be multiplied. So in the rate of, when you are doing when the respiratory rate is 12 and the dead space volume, the dead space is 150, 12 into 150 is almost 1,800. So in 1,800, the ventilation of 6,000 goes means out of 6,000, 1,800 means the alveolar ventilation is 4,200 only. Alveolar ventilation where the gas exchange is happening in the tertiary bronchiole, the giving out of carbon dioxide and getting the oxygen. That alveolus, that the alveolar ventilation is where the main gas exchange is happening. So in normal respiration, it is 4,200. In shallow breathing, people who are rapid breathers, especially the people who are obese or who are having a tummy, especially the center part is blown up for them. So they do a normal respiratory rate of 30. The 30 into 150 is 4,500. So in the ventilation won't change. In 6,000, 4,500 goes means, see the alveolar ventilation is there, only 1,500. So what kind of gas exchange is happening? Nothing. They will prone to respiratory disorders soon. In our deep respiration, I'm not calling it as a pranayama. Pranayama is different. The breathing exercise is different. But simple inhalation and exhalation, Sukha pranayama. Inhalation, inhaling 6 count and exhaling 6 count. That is Sukha pranayama. So if you inhale for 6 count and exhale for 6 count, the respiratory rate will be 6. 6 into 150, only 900. So 6,000 minus 900, 5,100. See the amount of alveolar ventilation or how much you are getting when you are doing a simple inhalation and exhalation for 6 count. This is simple breathing technique. And this is what mostly indicated in the COVID times. Do normal breathing, do some deep breathing and deep breathe out. How simple is this? This is scientific evidence how the breathing technique can help, how the breathing technique most of the neglected system is respiratory system, because people spend more on taking a echo, people are taking a Doppler and other kind of so many investigations. But how many are doing the spirometer, a spirometry test to assess your respiratory status? No one. No one. Once in 3 months, people go and do echo. People, some kind of gastritis, chest pain also, they will go and do ECG. But no one has a spirometer to assess your lung function. If your respiration is good, automatically your cardiac system and central nervous system will definitely be good, because respiration is a key. Respiratory is a key system to maintain your other CV system and central nervous system in a good way. So remember that this is a huge scientific explanation how a deep breathing is very good and what kind of value inclusion is happening. Now we are moving into the yoga therapy part, how it works and how it helps the people to come out of the problem. There are some proposed scientific evidences, like in pregnancy. Remember, birth is the first thing to happen in life. Yoga therapy has worked in that. We have did a study in our site, Doctors' Yoga department, alone by chanting Akara, Ukara, Makara, Om chanting. Improved physical strength and flexibility, relaxation of mind, body, improved self-awareness, body, mind, calmness. These are the mechanisms happen inside the body. And the outcome, see the outcome, decreased labor pain, increased maternal control, birth outcome scores like ABGA scores, like PLALA scores. Those scores got increased because of antenatal yoga classes. Just simply listen to the Om chanting. A beautiful bonding will happen between the child and the mother. That is the beauty of yoga. It happens at that stage itself. That is the beauty of yoga. And opposite, in the end stage, cancer. 12-week Iyengar yoga program for cancer-related fatigue. Remember, I already told fatigue, tiredness, nothing, no pill can take that fatigue and tiredness from oneself. Only the mental change will happen by yogic practices. It decreases the severity and duration of fatigue, improves in general health quality of life, and reduction in depressive symptoms, improved physical performance. That is the beauty of yoga, 12 weeks of yoga. And definitely in the end stage of cancer also, it makes the person to feel better. Yogic practices makes the person to feel better actually. It improves the quality of life. And in chronic backache, this is one of the commonest problems most of the people have, because we all are driving bikes for our jobs or for some other places. Bike is an easy kind of transport in our part, especially in South India and especially in Pondicherry or places like Chennai and Mumbai, where car we have to daily we have to go late, but bike is an easy way of transport. But the bikers will feel this low backache pain. And because of the low back pain, they can't able to sit, they can't able to lie down, and they can't do anything, because for everything, spine has to be flexible. That's why spine is moving in all kind of direction. If the spine is not flexible, if you just do a simple twist movement, you will have a cruciating pain, a pain that feels like just lightening. That kind of a pain will happen, and it causes numbness also. And yoga practices that impacts cognitive appraisal, positively impact affect and stress, improves neuroendocrine function, and decreases the pain and dysfunction. These are scientifically studied, and it has been proposed. I'm not saying, I am not copied it. These are the slides from Dr. Anand Balayogi sir's slide only. One of my favorite things is Mukha Bhastrika. It's very easy to perform, and if you perform this Mukha Bhastrika, it will be joy for you actually. And what it happens, it allows the faster rate of information, improved concentration power, ability to ignore or inhibit exogenous stimuli. Dr. Meena Ramanathan Madam has studied this finding in a special Divyanga Yoga children. Even for Divyanga children, Mukha Bhastrika worked for them. And what was the output? Enhanced central neuronal processing and sensory motor performance. For Divyanga children, the yoga therapy has enhanced the neuronal processing and the body motor control, that performance, that has been improved. That is the beautiful of a technique called Mukha Bhastrika. And postulated mechanism that yoga plays in reducing the cardiovascular disease. See here, yoga acts in a two-way method. One method, a vagal stimulation that causes parasympathetic activation. And straightly, by vagal stimulation, it can increases the heart rate, increase the barrel reflex sensitivity, decreases the inflammatory cytokines, decreases the heart rate and blood pressure. So all together, what causes improved coagulation profile, decrease oxidative stress, and increase endothelial function. Endothelial damage is a very basic pathological function that ends in organ damage. And that was addressed by yoga. And that function is increased by yogic practices. And the end, what is the output? Reduced risk of atherosclerosis, hypertension, and coronary vascular disease. The same thing was applied in diabetic mellitus also. Yoga intervention in one way by decreased perceived stress, activation and reactivity of sympatho-adrenal system of hypothalamo-pituitary axis. Yoga plays a major role in controlling the hypothalamo-pituitary adrenal axis. The major functions of the endocrine, the major driven part of it, and vagal stimulation, parasympathetic activations. So all these mechanism of actions plays a huge role inside the body by repeated practices of yoga, and reduces the risk of type 2 diabetes and the complication. If you got type 2 diabetes, yoga will definitely reduce or prevent you from its complications. I already told the micro and macrovascular complication, what diabetes can do. It is a silent killer. And there is an interconnection between the inner correspondence, peaceful harmony, mindful acceptance, mental emotional stabilization, in a mind-body intervention such as yoga. Even the inner correspondence and peaceful harmony has been studied, and it has been postulated, and the mechanism of action is well studied. That gives yoga practices, gives mental stabilization to the mental stabilization, stress reduction, and because of stress is reduced, blood pressure is reduced, and because of decreased blood pressure, the decreased symptoms, life satisfaction, and improves the quality of life. If one quality of life is improved, what else we want actually? That is the most important. That is the key factor actually. And the most important, the simple pranayama, the classical pranayamas like Chandanadi, Sukha Pranayama, Savitri Pranayama, and Pranava Pranayama. Again, Pranava Pranayama plays a huge role. The most important thing is these pranayamas not only normalizes of autonomic cardiovascular rhythms, enhance cardiac autonomic regularization, improved barrel reflex sensitivity, and the most important thing is integrated relaxation response with decreased afterload. What is this afterload? Afterload is be more when person is having a myocardial infarction, heart attack. That afterload, that The preload, afterload will be more in person who is suffering the myocardial trauma. Yoga helps to relax that by practicing these pranayamas. That will be decreased. The afterload is decreased by practicing yoga, and because of it, the mean pressure, heart rate, systolic pressure, diastolic pressure, rate pressure product, everything is decreased. And these practices, these pranayamas are valuable for hypertension, diabetes, metabolic syndrome, and overall it is a good pranayama practices to remove the stress also. That is the beauty of these pranayama techniques. The breathing, it's not a breathing exercise, the breathing techniques in yoga. And the global functioning of yoga, how the yoga therapy works as a make the individual as a whole person by improving the fitness, self-regulation, awareness, spirituality. All the key elements of yoga has come and applied on a person, and automatically it improves everything from psychological level, spiritual level, emotional level, and physical level. This is the global human functionality is overall improved by yogic practices such as the asana, pranayama, kriya, and the mudra and ganda. The 10 point of yogic plan is yogic counseling to develop awareness, cultivation of appropriate attitudes as Maharishi Patanjali tells us. Healthy, heart-friendly diet, a sattvic. Without diet, there is no therapy at all. The therapy won't be completed if we are not addressing the dietary, if we are not addressing the diet of the particular person, or if we are not giving any dietary advice, that the whole treatment is not completed without diet. Diet plays a key role in managing the disorders. Breath body coordinated practices, yoga asanas with modification, pranayama to balance energy flows, kriyas to cleanse the toxins, especially the shak kriyas, and mudras to reset the neural mechanism, yogic relaxation and visualization for self-healing. Give some space, give some time to the individual, to yourself. At least spend 30 minutes to 45 minutes to yourself. Definitely it will heal you. Dharma and Dhyana for inner vision. An integrated approach is a need of an hour. Recently, there is some huge mess happened because of Guru Baba Ramdev's message and the Indian Medical Association. There was a lot of that I feel very bad because I follow my Guru step, Dr. Ananda footstep. He is a proud member of Indian Medical Association and Indian Yoga Association. I also say that I'm a proud member of Indian Medical Association and Indian Yoga Association. We need to integrate. We never thought about this integration. We have to join hands and work together whenever everyone is suffering. So the need of our is an integrated approach. The need of modern age is to have an integrated approach towards therapy. Yoga therapy can be utilized in coordination and collaboration with other symptoms of medicine, allopathy, Ayurveda, Siddha, and naturopathy, physiotherapy, and other practices. Advice on diet and lifestyle is very important. Adoption of right attitude through yogic counseling is the basic principle of yoga therapy. And I already told that yogic practices, especially those done mindfully, will strengthen our immune system. It helps to regain the cortical control. If the cortical control is not gained, we will be ruled by our emotions and by our senses. But yogic practices help to regain the cortical control. Through yogic self-care, we can be our true selves. Remember this, we need to stay safe and stay healthy if we are to help others. First, we have to think about us, then about others. So, to be a competent yoga instructor or therapist, I think this slide was be discussed in the previous by previous speaker also. But to just go in a fast way, we require intelligence and empathy, not sympathy, empathy. Willing to share, as my guru do always in all the scintillating Saturdays. Willing to share and care. Need to understand our limitation. Realize we are not perfect. Definitely, no one is perfect in this world. Even the divine is not perfect in sometimes. We can think like that because of this COVID issue. Be willing to embark on continuously expanding the learning curve. Every day, every minute, every second is learning. The day we stop learning is the day we stop living. If you start to think that you are better than someone else, that day you are finished. Your chapter is developed. And the last thing I want to say is yoga therapy without yoga is no longer a yoga therapy. If a patient is having a cough, giving the cough syrup without identifying whether it is a dry cough or wet cough, whether it is a cough related to upper respiratory tract infection or lower respiratory tract infection, whether the cough is expectoration, that he is expectorating some sputum, or cough without expectoration, or simple cough, these many things are there. That is by appropriate principles, we have to address those things. And yoga therapy given along with the yogic way. If there is no a single point of yoga, then it is a physical exercise. It is not a yoga therapy at all. It is a pure yoga pati, not even a yoga pati. It's just a quack kind of a business. So I conclude by saying, by positive thinking, feel good, regular exercise, eating better, constitutes a healthy living. And this healthy living is adopted by the practicing yoga or applying that yoga to other person as a yoga therapy. These things can be achieved definitely. As my Guru's father, Dr. Swami Geetananda Giri always said, health and happiness are your birthright. Do not forsake your golden culture for the plastic ratings of the modern world. Learn and live yoga, for then you will know true health and happiness. Acknowledgement to my Guru, Dr. Anand Balayogi Bhavanani sir, my director, Dr. Madan Mohan sir, Dr. Ramesh Vigilani sir, and the Divine Yoga, and to my dear Nilacharji for the opportunity to connect with you. Gratitude and thanks to all who attended this session. And I just crossed over my time. I'm really sorry if I start speaking. This was happens. My wife's common complaint. So really sorry for making you to sit for a long time. And gratitude is the highest attitude. I have learned recently about these things. So this is vital actually. And I request all of you to get a COVID vaccine as soon as possible. So without, I stop sharing and I stop my talks. Thank you.
Thank you so much, Dr. Balaji sir, and really speechless like sort of thing happened, and every minute of this session is very crucial, indispensable, and it should be revised again and again, and then only we can understand it in a more way. All the participants here are in one or the other way are yoga therapists or yoga professionals, and they must be experiencing the same, I think, and a very a deep knowledge you have shared, and really very enlightening for all of us. So without taking much of the time, I will just take one question, and I will invite Dr. Ananda sir for more clarification, more of his comments. So there was a one question regarding yoga therapy, that can sun salutation practice be used as a yoga therapy after post-COVID? This is a question, sir. Balaji sir, am I audible to you?
Yeah.
Yes, sir.
Yeah. Yoga therapy, Surya Namaskar practice can be done after a COVID session. That is the question.
Yes, sir. Can sun salutation practice be used as yoga therapy after post-COVID?
Definitely it can be used because Surya Namaskar is a thing which constitutes or which is made up of asana, pranayama, kriya. So everything is there in Surya Namaskar. A few rounds of Surya Namaskar will help to balance everything together, the body, mind, and emotion. So definitely Surya Namaskar practice is recommended if he is not having a breathlessness, if he is not having fatigue, and he is not having some other illness. Definitely Surya Namaskar practice can be given to the post-COVID patients.
I hope Dr. Ashish Aryaji, you got your answer. Now I would like to invite Dr. Ananda sir for his valuable comments.
Vanakkam, sir.
Yes, sir.
Namaskaram, Swagatam, Vanakkam. Congrats, Bala. Very, very beautiful presentation. You have outshone yourself. I think it's one of your best presentations I've ever heard you give. So my blessings, my congratulations on putting it together. And often I heard myself speak through you. So that's a very beautiful experience. I think for a teacher, it is very important to have that. So to have the thoughts come through is very beautiful. And before I go forward, I would like Devasena to say a few words because Bala is one of her favorite sons. So let her first talk and then I'll come. Let the heart talk and then the head will talk.
Namaste everyone.
Vanakkam, boss.
Vanakkam. Wow, what your presentation, Balaji. So happy. You made us so proud of you. And so really, really nice. And you work a lot, you help a lot. Also, you gave a lot of information. You learned a lot. You are giving a lot actually. You gave a lot in the presentation actually. It was so much, actually, it was very happy to hear you. It was so clear and so informative and many things actually. And really, really nice to hear all of that from you. And of course, you are following Dr. Sir exactly. Happy to see that coming in your, and teaching in your seva. And I like that instant karma thing. If it's coming like that, we won't have too much luggage in the back. So it's nice, good point. And many points. You are learning a lot and doing a lot. And I with Balaji, actually, I feel like he's in the different form, actually. So whenever we need like in the emergency, he's just like, he's flying and coming like a Hanumanji. So within 10 minutes, because he's the Vayuputra, Prana Kumara, we call Lord Hanuman. So Hanuman, actually, we feel like it's a, Hanumanji is a form of Lord Shiva. So like Dakshinamurti, when he's teaching silently, we call him Lord Dakshinamurti, facing south in the north. So we feel like, the form of Hanuman. So Hanuman, because he's also a devotee of Hanuman. And of course, any emergency in the thing, anybody actually, for us, totally, for Yoganjanatayam group. So I started to feel that Gitananda society, even, Gitananda family, even, he started to help everyone. Whenever they are asking something, the emergency, he's there. So I just remember, because Surdas, I think they call like hymns or ode, like that. So refrain that in that, it comes like a, it's in the Hindi, I'm not sure exactly. Nirbal ke Balaram, Nirbal ke Balaram, Nirbal ke Balaram, Ram Balaram, 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 Ram Ram Ram, Nirbal ke Balaram. The Sudas, that's actually, it's the one of the name of the Gandhiji's, the whole experiment of his truth, whole experiment with his own truth. In that, he called as the chapter, 21st chapter. The name is from the Surdas hymn, actually. They call ode also. So that means that when we feel that no one is there, helpless, hopelessly, nothing is there, no one is there. In that time, somebody in some form, they will come. So he's God, actually. So my father always says, the Manushya, the Deva comes in the Manushya Rupa. So like that, he's there for any emergency in anybody. When they ask him, approach him, immediately he's there to help them. So I felt nearly in every situation, I felt with him, like the Hanuman's, that energy with him. So he's also devotee of Lord Shiva. That Hanuman, and of course, Shiva's energy also in Hanuman. So that's what it's coming like that. So I feel him that he's really fulfilling his dharma, because he's helping in the different hospitals, and helping many of them, when even outsiders and whoever ask him, not only Anandashram family, like that. So he's really taking like a seva marga, like a bhakti yoga. He's doing, whether he's practicing or not every day, but he's learning a lot and doing a lot and becoming like in that seva, bhakti yoga. He's really giving his seva. So I pray Almighty, his, our gurus, the Gitananda Parampara gurus blessing is always there for their whole family, of course, for every one of you in the Gita and the family, not only that, whoever coming in the path of yoga, they get the whole Parambara's Ashirvad. So I pray for him, the Almighty, give the energy, strength to continue, fulfill his dharma in the life. That's what my sankalpa. Dhanyavadaha.
Thank you. Thank you, miss. Thank you very much.
Thank you. Thank you, sir.
Whatever I'm gaining, all things to you and sir. Whatever I'm not gaining, it's because of me. Thank you, miss. Thank you for the blessing and Ashirwad for all of it. Thank you.
Thank you. Thank you so much, Nilachal. The great experience you are giving everyone, making that thing coming out. As Daksha said, when you know the switch to turn on, then the energy can pass. So you are like a switch turning on to make the energy to pass through to everyone and give the energy to all, and making the point that there is a energy, there is a thing. So feel that, take that. So that's a great gift you made in this, arranging this opportunity, giving for everyone. Thank you. Thank you so much, Nilachal.
Thank you, Devasana Miss, for the heartful blessings, which are so true, because Balaji is a true doctor at multiple levels, because a doctor is not just someone who prescribes medicine. They have to facilitate the healing of the individual. And healing involves becoming wholesome once again, is becoming yourself once again. So he plays that role in multiple dimensions. Coming to the topic today, I would like to make a few points, and I will tomorrow in my concluding session address the Yogopathy topic. And so if I don't, remind me. The Yogopathy, which for me for the last 15 years has been one of my pet projects. And in recent times, salatogenesis has become a pet, but Yogopathy is always my first pet, because I see that we are caught into prescriptive yoga therapy. And again we find this prescriptive yoga therapy, which is not really yoga therapy. And again, the use of yoga techniques to manage issues symptomatically without doing root cause analysis. So I will address this tomorrow. I would like to also bring out the point here that keeping our limitations in mind is very important when we practice yoga as a therapy. Now, people like Bala and myself, we are licensed medical professionals. So, we get a bit more freedom because of that medical license. And other people who are mental health professionals will have that freedom because of that license. Or somebody who is a physical therapist, or somebody who is a nursing professional, they would have a bit more freedom because of the licensing pattern that is there. However, when we do not have that to fall back upon and are primarily focusing on yoga as a therapy, we need to not overstep. I think this is one of the big dangers, is we should understand the danger signs. As Bala said, you should know what not to do first. I think what not to do is more important than what to do. And if you know that, you will never do anybody any harm. The first rule of modern medicine is do no harm. The first rule of yoga is ahimsa. So both come together. And even if we cannot help somebody, it is fine. We should not harm them. And no harm should be always our primary aim in the approach to yoga as a therapy. Now, it is very easy. As Rama Reddy sir recently said, when you only have a hammer, everything looks like a nail to be hit. When you only have a hammer, you think everything is a nail and you have to hit it on the head. I think we have to be careful that we don't go looking for nails that don't exist. We have to be very careful here. And this is why Vairagya and Viveka, and Bala, he borrowed a lot of my slides. Nice to see them. And they are from so many different presentations. I'm like, at least Bala went through, 20 of my presentations to get 20 of the slides. So I'm like, wonderful. It's always nice when you see it. And as I said, I felt him talking. I felt myself talking to him. So it was a beautiful experience. As a teacher, as a parent, it's so important to see that. To be a competent yoga therapist, both your head and your heart should be working. So your heart should want to help the person. Empathy has to be there. Compassion has to be there. A capacity to give of yourself should be there. But at the same time, you should know what to give, when to give, how to give, and what not to give. That is where the head has to come in. Because if your head is not working, you will be like the Boy Scout. You know Boy Scouts? Yeah. You know what? There's a Boy Scout who's standing at the corner of a street, sees an old woman at the street, and what he does is catches hold of her and takes her across the street. Now the thing is, he's very happy. I've done my good deed for the day. I've taken my old lady from one side of the street to the other side. The problem is she never wanted to go to the other side. And I often think in our enthusiasm to help others, we are like that Boy Scout. We want to help others for the sake of helping. Do they need your help? Do they really need your help? And this is why more and more I've started to believe that one should take a step back. This is called Vairagya. Take a step back and see whether you are really needed in that situation. First point, because sometimes you may be the problem in the situation, okay? You being part of it and trying to help may be part of the problem. And I've seen a lot of this with people, what we call pathological goodness. Pathological goodness and pathological helping tendencies. When trying to help someone, they create more problem. I have seen that. And again, one more very clear message here. People who know will often they'll take a step back. People who don't know, jump in. People who don't know, jump in. So be very careful. Because those who are wise will understand what is needed. You see somebody who has certain issues, you just have to stay for 10 minutes and everything will be fine. But what they do is they try to go in and they start to aggravate the problem. And this is why my mentor, Anantakrishnan sir, he is one of the best surgeons of India. He used to say the role should be like a midwife. Our role should be like a midwife. You should be observing with vigilance and you should step in only when needed. You should observe with vigilance and step in when needed and don't rush in to deliver the baby for the mother. Today, we want to go and deliver the baby for the mother before she is ready and before the baby is ready. In our ignorant enthusiasm. And I will add arrogant also to it. The ignorant, arrogant enthusiasm, and the more ignorant and arrogant people are, the more enthusiastic they are. And I tell you, these are the people who really give yoga and yoga therapy a bad name. And the medical community, when they see that, they're like, all of you are like this. And I say, no, we are not all like this. They say, well, look at that person. And the person has, status asthmaticus, and this person, instead of referring to the hospital, was telling them, don't worry, this is nothing. I will teach you Kapalbhati. Please, please. I have seen too much of this nonsense. I have seen too much of this nonsense. And one has to be very vigilant. Vigilance is the price of freedom. Vigilance is the price of responsibility. And we need to be responsible for ourselves. Again, the next point as a yoga therapist, if you are not healthy, how can you help anybody else? So we need to be healthy. We need to be stable. I find so many people in yoga therapy and spirituality who are unstable, insane bipeds. I'm sorry to say it. And there are so much of instability. And I'm like, seriously, these people are a walking catastrophe in the making. And they just, wherever they go, they create a problem. And then, you are firefighting all the problems because they are unstable. If you are unstable, how will you help anybody else? So our own personal sadhana, our own personal self-reflection, strengthening our tools and strengthening our capacity to bridge the head and the heart. The head and the heart have to be working. Most people, there's a block here. So either it is head or heart. And there's a big block at the neck. This is why we do Brahma Mudra. Brahma Mudra is unblocking the connection between the head and the heart. And suddenly your head and heart can work together. People say, oh, my heart says something, my head says another. Well, that's because there's a block. Start doing Brahma Mudra. I'm prescriptive yogopathy. Start doing Brahma Mudra. You start to unblock the flow. You unblock the flow of the sensory processing from the body to the head, including from the heart to the head. And you start to unblock the motor function from the cortical areas down to the rest of the body, including the heart. Sensory motor coordination starts to be enhanced. So this is very important. So Balaji's presentation has given us a very beautiful overview, and I think most will need many times to watch this. And I'm very, very happy that Nilachal is creating, a playlist with the YouTube videos. And I think this is a very important resource to be shared with people. And once again, just remember, yoga therapy without yoga is not yoga therapy. And yoga has to be part of it. I remember a dear friend of mine, a colleague of mine who wrote a book on yoga therapy. And he had wanted me to release it, but I couldn't release it because the same day I was flying to Australia. And later on, I came to know why I couldn't release it, because when I looked at that book, he had made a statement. He said, when somebody comes to you for yoga therapy, don't teach them yoga. Now I know what he meant. Okay, I know what he meant. But that statement to me was, I'm like, that is why Dr. Ananda did not release that book. Because I disagree with it. I know what he means. He means don't start teaching them all the yoga you know. That's what he means. But he could have said it differently. Someone comes to you for yoga therapy, don't teach them yoga. I'm like, well, I would reframe that whole statement, because yoga therapy without yoga is not yoga therapy. And again, we should use the word yoga chikitsa, because chikitsa is the technical term for what we are doing. The word therapy has very, very different connotation, but we use it as a translatable term. But as someone said recently, there are the untranslatable, intranslatables. And chikitsa is one of those, because chikitsa means a wholesome approach. So I will approach that tomorrow. Okay, I'll approach that tomorrow. Today is just the trailer run for tomorrow. And I will take off from where Bala has left off and take it forward. And if you have questions, hit them away tomorrow, because it will be more an attempt to sum up the last 1 week of sharing. And through this, we hope that a new dimension is opened in your consciousness. That is the most important thing. And I will share some of my successes and my many failures as a yoga therapist. Because I think from the failure, we learn so much, that in the failure lies the seed to future success. And we often only like to talk about success stories. I've had my share of failures also. So I may share a few of them, because from those I've got new dimensions of awareness I would not have got otherwise. So thank you all for being here, making this happen. May the blessings of the Guru Parampara be with all of you. And just remember, yoga is a living tradition. And when you follow it, when you practice it, when you live it, it comes alive in you. And never forget that. Yoga can live in you and live as you. Dhanyavada.
Thank you, sir.
Thank you so much for those words of wisdom. And as Sir said, this is the trailer that we have seen today, and tomorrow will be the actual movie that will be released. So for tomorrow, get prepared. And tomorrow the session will be at 5:30 p.m. IST. So well prepared for that, and we will be meeting tomorrow. And thank you everyone for joining us today. And there are few information that the feedback form that you are filling, please keep filling them as we are able to reach to you with all the links and all the other resources. And the video links are always available in the links of YouTube. You can see them if you have not seen, and today the video will be again uploaded. And with these words, just as the sir said, we have to be the change to bring the change. So this is the message that we can take it from here. And thank you all. We will invoke Shanti part and we'll finish today's session. Om Swasti Prajabhyam Paripalayantam Nyayena Margena Mahi Mahisha Gobrahmanebhyah Shubhamastu Nityam Lokaha Samasta Sukhino Bhavantu Sarve Bhavantu Sukhinaha Sarve Santu Niramaya Sarve Bhadrani Pashyantu Ma Kashid Dukh Bhag Bhavet. Om Shanti Shanti Shanti. Thank you all for being a part of Live Holistic team and with the mentors of Gita Nanda Yoga Traditions. See you tomorrow. Be prepared for a grand event. Thank you so much.